Hey everyone, welcome to the Bringing Care Home podcast. I'm your host, Jared Taylor. Joining me today is Josh Hix, the co-founder and CEO at Season Health. How are you today?
Great. Thanks for having me.
You just go by Season or do you go by Season Health?
Depends.
Either
Shortened.
or?
Yeah.
Yeah, shortened to Season. I like it. Great name. Let's kick things off, Josh, by you telling the audience a little bit about you, and then we'll dive deeper into Season.
Sure. I'm a lifelong entrepreneur. Probably means I'm crazy and unemployable, but Season is company number 4. Um, Spent a little bit of time in healthcare about 15 years ago and learned what was really a tiny amount, but felt like a lot. It turns out to be the tip of the iceberg before going off and starting a purely consumer business, which was plated. So we were one of the meal kit businesses. This is now 11 years ago, which is crazy. So summer of 2012, started plated with a friend and was really, relatively early in the D2C wave. So grew to national scale. We were delivering, large numbers of meals all over the country. And out of the blue one day, got an email from a health plan. We get on the phone with them and they say to us in so many words, hey, a bunch of our members are telling their doctors that they're healthier, they think, because they're using plated. And, in the best of all ways, like, what is up with that? Doctors can't get people to change behavior, hardly at all. And yet people are accidentally having these positive, health outcomes. Their blood sugar is under better control or whatever it might be. And they really wanted us to help, try to figure out what was going on there. So we spent a bunch of time with them interviewing patients, trying to get our arms around what was going on, and also figure out if there was a business there. I think we got to a good place on the first thing, but then on the business model decided there wasn't really a great way to engage. So ultimately put that work on the shelf. Fast forward many years, we sold plated to Albertsons. I spent some time there, learned a lot about grocery. And as I was figuring out what was next, kind of had this half, probably quarter finished idea in the back of my head, which was like, what was all that, what were all those questions about food making people healthier? Started Season right before quarantine, early 2020, out of an attempt to put food and healthcare together. My co-founder, Mustafa, had been founding CTO at Quartet, which is a very large mental health business. And then our sort of founding advisor was Dr. Andrea Feinberg, who had been the founding MD for the Geisinger Fresh Food Pharmacy. So we spent a bunch of time in 2019 together and really kind of, equal parts scaled consumer food, scaled digital mental health, and then clinical best practice around food as medicine. And the first version of Season is what came out the other side.
So cool. It's funny. I always go back to that Steve Jobs quote, right? You can't connect the dots looking forward. You can only connect them looking back. And it's funny how yours align to those conversations to kind of bring you back to something that you've heard in the past. I think it's absolutely great. I think this is where healthcare is heading. Finally, we're starting to dive deeper into. It's not just medications. It's, hey, maybe fitness is medicine, food is medicine. Like, start exercising, start eating healthy, and wow, you feel better. I follow that. Who's that doctor? Everyone follow Dr. James something. He's all about like all healthy. I'm blanking on his name. James something, but he was talking about flu season coming up, and he always says, part of me wonders why flu season follows Thanksgiving, lots of sugar and cookies and pies, and then the rest of the other holidays, and all of a sudden flu season's here. Like, so it's diving deeper into, what are we eating? Like, I know for me, I stopped eating preservatives, or at least limiting preservatives, and I felt 1,000 times better. This was not like a doctor didn't tell me, right? I just decided like, hey, preservatives don't make me feel good. I'm going to stop eating them. So we'll see how it goes. But I really like your approach. I did go into the platform to like, go through the process, super clean, like well done. Obviously bringing on, the team that you did. it shows. Um, what has been some of the bigger challenges that you've had to face in this space? Obviously, you face your fair share of challenges being a serial entrepreneur. Um, Talk me through that.
Yeah, and appreciate all of that, and certainly we've put a lot of focus on the consumer experience. So always nice to hear that that's paying off. Uh, that said, there's a tremendous amount of work left to do there. In terms of challenges, I think the reality is that for an early stage company, everything's a challenge, or at least everything has to get started. You have to kind of build, inertia around literally everything from the mundane, important stuff. How do you set up payroll to the bigger, kind of longer term important things like how do we get a health plan to actually engage with us, and then how do you set yourself up to be around for the full sales cycle, which even for an established product and category is a long time. I mean, here estimates anywhere from 12 to 36 months in some cases. And for a new category where the evidence is still being built, where the kind of groundswell is still happening, it's many years. It's an indeterminate amount of time before it will be fully widespread that food can be a treatment. Even this is not really at this stage, I think, of all of this about preventative medicine or about sort of health and longevity. Although obviously there's a case there. It's really about the short term chronic disease management where there is demonstrable ROI for a plan. So I think really just figuring out what the right way to engage with the plans was, which is an ongoing process. It's not that we have it all figured out. That's been probably the sort of headline challenge. And there's a very long list of other small, medium, large challenges behind that.
It's probably going to be hard for you to pick one thing, but what is your favorite part about building this business?
It's actually pretty easy. My favorite thing is that at the end of all of the challenges of long sales cycles and complex business models and everything else, that there's an actual measurable human impact. I think people do this work for different reasons, but at this point in my life, it's really satisfying to have patients who are measurably helped. We see patients all the time. We try to stay close to that. Obviously, it's not always the right thing or possible to know exactly what's going on, but we do have a pretty large number of patient testimonials, folks who raise their hand to share their story and their journey with us, and I think all of that is really the ultimate payoff.
It's I do want to mention this a little bit because we were both just at the health conference, right? For the first time, they had a food as medicine row. You were a part of it. What was it like talking with some of those other companies that are not necessarily competitors, but are all about the food as medicine and using food to make people feel better?
We're partnered with probably half or more of the other companies that were there. So in a lot of ways, it was just a fun mini reunion. You see a lot of those folks everywhere. I think in terms of what we hear from them and others, even the folks that are directly competitive, is there's a real sense of I think rising tide sort of lifts all boats from a business perspective, and also a shared sense of mission and a shared sense that we've all got to get this right. There's still a lot to do. I think when I talk to my old consumer friends, some of the frequent kind of questions sound like, isn't it obvious? Like, why doesn't my plan pay for this already? And I think that the thing that folks, don't necessarily realize is these plans, rightfully so, like they need to have a demonstration that, that it works, and not just works in terms of making people healthier, but in terms of their business model, that it makes people healthier with claims, with total cost of care reduction. And it just takes time. It takes a long time. And there's a lot of open questions and noise around the space. So, It's something that everyone's got to tackle together. It's a multiplayer game.
There's some things though in life that are just obvious. Even if I don't have the science in front of me, it's just obvious. And people eating more healthy and it is. I know why they have to go through the process, like you're saying, and they have to be able to prove outcomes and see that people. But it's just like wow, like we've known this for a while, right? If you eat healthy, it is going to have positive impacts on your health. I think it comes down more than even that is what you said. Does it? How does it fit in the business model? Is what they're trying to figure out, right? It's not that they don't sure they want to see the information, but everyone knows that you eat healthy, you're going to feel a lot better.
Yeah, I absolutely agree. And I think those details are like everything in in business, maybe in life. The details are really what end up mattering. And is it one dietitian visit per month? Is it two? Is it 2 months worth of food, or is it 4 months worth of food? Is it those are the details that really matter to making the business work. And if the business doesn't work, then it won't last. It won't be sustainable and scalable. And so those are the pieces that we're collaboratively working through from a research and testing perspective, with partners and with plans.
At what point, Josh, like how early in this venture did you realize with your team, like, hey, we're really onto something here? Now, I've heard it a bunch of different ways, right? People are like on day one, like when we had the idea, but like at what point when building this business were you like, I'm really okay, things are coming together. I really see that we're moving on the right path here.
I feel like we've had a series of those moments in true roller coaster fashion. So it's you're you're climbing. It feels like everything is great, and it's that moment, and then the bottom falls out, and over and over again. We certainly had some of that in the early days. It is obvious in a lot of ways. Like you eat healthier, you get healthy. So there's a lot of resonance with folks, certainly at the kind of patient or just consumer level. But then you got to get a plan to engage with you. Um, so the first plan, when there's no evidence, that's a huge moment. Then when you start having anecdotal clinical outcomes, huge moment. I think probably the first real big proof point, which was cause for celebration, was our outcomes with Geisinger, which showed that it was possible to do the work they were doing offline, at smaller scale, online, and at larger scale, and have similar outcomes. That for us was a huge proof point. And look, to be real, there's still not a fully complete claims analysis. So that is the next peak that we're climbing. That'll be next year at some point, but that's the real I think kind of end point of all of this work is in a true randomized controlled trial proving with statistical significance that these interventions drive a reduced overall cost of care. So in many ways, that ultimate aha moment is still in front of us.
What's next for the business that you can share with us here today?
Yeah, that's certainly one of those big next things. We have other condition state programs, so food as medicine for other chronic diseases and other conditions that we'll be launching. Also at this point, probably next year. We do have some other big announcements that I can't quite share yet, but that'll be out in the next few weeks. But really, I would just say it's continuing to build the evidence base for, especially the clinical side, yes, but I think more and more that's becoming accepted. So it's building the evidence for the ultimate claims analysis, the ultimate business case with plans. And then rolling that out across various conditions, all conditions which are impacted by diet, which is a lot.
Well, Josh, I want to once again thank you for joining me on the Brain Care Home podcast, and thank you so much for what you're doing and this business that you're building. We'll have to have you come back on in the near future to give us an update on where things are at. But look forward to staying in touch with you and following along season.
Would love to do that.